Okay, welcome to Health and Social Care at Beacon Academy Sixth Form. Health and social care is a subject that's well worth considering if you are thinking at all about working with people in any kind of care capacity or going into an allied medical profession or into early years education or primary school teaching, anything like that. Our previous students have gone on to a variety of different careers, from health visiting to nursing to primary school teaching, physiotherapy, psychotherapy, social work, paramedics, speech and language therapists, midwifery, all sorts of different careers. So if you're interested at all in a career that involves working with people in that kind of role, then it's definitely worth considering this subject. Some of our students have been really clear when they've started the subject about exactly what profession they want to go into, and they've gone on to that. Other students have come onto the course not entirely sure what profession. They might have changed their mind a few times, but as they've progressed through the course, their thoughts on, whether to do paramedic science, for example, as opposed to becoming a nurse, or whether to go into primary school teaching as opposed to working as a, social worker, those choices have become clearer through doing the course, through understanding the units, through going on work experience placements, and they've gone on to do their different degrees at university and have done really well. Health and Social Care at Beacon is taught by two of us in the sixth form. So myself, Ms Trivedi, I run the department and have been teaching health and social care for a number of years, and also Mr Lister, who teaches health and social care as well as being a head of year and working in the PE department. So Health and Social Care at Beacon is a course that is equivalent to 2 full A-levels. That means it comprises of 12 different units over 2 years, and all of those units are assessed one way or another. They are either assessed via coursework, so it's a portfolio of assignments that you build up, or they're assessed via an external examination that you sit. None of the units would be assessed by both methods. It's either one or the other. And the assessment grades, because it's a technical diploma, the grades range from a double pass, a double P, to a double distinction star, so a D star, D star. A double pass is broadly equivalent to a double E at A level, and the D star, D star is equivalent to an A star at A level. And just like A levels, the Cambridge Technical Diplomas also attract UCAS points, so you can use them to go on to higher education and university degree courses. In Year 12, these are the units that we study. So you'll see from those units that 4 of them are examined and the remaining 3 are assessed via coursework. And there are a broad range of units in Year 12. They are foundational units, fundamentally important, all the way from learning how to build effective, positive relationships with vulnerable clients, to nutrition, to safeguarding, again, extremely important when you're dealing with vulnerable clients, infection control, all sorts of different units in Year 12. And in Year 13, we'll build on those units. So you'll do anatomy and physiology, very important to know about the human body and understand how it works. So that is the biggest exam. That'll be taken in the January of Year 13. That's a 2-hour paper. And then the remaining 4 units on sexual health and early developmental stages, physiological conditions, and supporting people with dementia and mental health conditions, they all build on the work that you've done in Year 12, and they're all assessed via coursework. As I said earlier, this is just a reference slide for you, really, showing you how the different grades for the technical diploma equate to the different grades at A-level, and therefore what number of UCAS points they attract. Okay, so under normal circumstances, our students would also be going out on work experience. It's no longer a mandatory part of the course, but it is something that we would strongly recommend. They would be going out to a variety of different health and social care settings, GPs, hospitals, surgeries, primary schools, etc. And there is, from all the feedback we've had from previous students, there is nothing like work experience to really understand what some of these job roles involve, what it is really like to work on the front line of health and social care, and what it's like to kind of be part of a team involved in some of these settings. Unfortunately, at the present time, because of COVID-19, we cannot send students out on placement. So all health and social care work experience placements have been suspended because of the nature of places that we send students to. So, going to care homes, nursing homes, hospitals, even primary schools and nurseries, it's not really appropriate to send students out. We are keeping a very close eye on the situation, and we will resume placements as soon as it's possible, if it is possible to do so. If we cannot resume placements, just to reassure you that in terms of your subject knowledge and completing the course and getting your qualification, you are not going to miss out at all. Going on work experience is an added bonus, really, which we love sending students out on placements. Students love going out on placements, and if we can do it, that would be great. If it's not possible, then in terms of actually gaining your qualification, you won't lose out on that. Okay, so just a final slide from me. If you want further information about this course, then I'm very happy for you to email me and I will answer whatever questions I can. If you can also, however, look on the exam board website. So OCR will give you lots of details about the actual course that we do, and this link as well is another OCR link. And UCAS will give you information about technical diplomas and entry requirements for university degrees and how Cambridge Technical Diplomas can contribute to that. So that's it from me, really. What we thought would be really nice for you is to hear from students who are taking the course at the moment. So some of our year 12 and 13 students have very kindly put together little videos for you so you can hear from them as to why they decided to take health and social care and how they feel about the course. So I hope you enjoy that. And please do email if you have any questions at all. And I look forward to meeting you all in September.
Katie, I've always wanted to have a job in health and social care, and when I heard about there being 5 exams and 7 units of coursework, I was glad. I prefer coursework as it allows you to have enough time in order to get the best possible grades and ability to ask questions. In health and social care, you have the ability to enhance your confidence, empathy, and relationships. Don't worry if you didn't do GCSE, all you need to do is pay attention and try hard. If you have any desire to work with people and learn how to treat people with respect, this is the best subject for you.
Hi, I'm Caitlin. I am Year 12 and have just begun A-Level Health and Social Care. In the future, I want to be a paediatric nurse, and this course has really opened my eyes into what life in healthcare could be like, as the work applies principles to everyday scenarios. I chose health and social care because it is something different and it is not solely based on exams, but coursework counts too. One thing I love is the atmosphere, as it is open and supportive of everyone, which makes the lessons really enjoyable.
Hello, my name is Eleanor and I'm a Year 13 student at Beacon Academy Sixth Form. I picked health and social care for many different reasons. The first one being that I always wanted to work in a profession with people. Back in Year 12, I wanted to be a midwife, yet now I'm an aspiring secondary school English teacher. Both of these professions, along with many others, would be benefited by learning health and social care because it teaches you the fundamental skills in which are required for working with individuals from all walks of life. A-Level Health and Social Care is different to GCSE because there are more units and they are also taught more in depth, which allows you to have a better insight into what you are learning. The content in which we learn is also relevant to most, if not all, aspects of the working world. My favourite unit that I have done so far is probably safeguarding, because the legislation elements were of much interest to me, as well as the way they can be applied and enforced in all areas of work to ensure the safety of those around us. Some tips for doing the course are to listen, have empathy and respect those around you, as well as work hard from the very first lesson. Revision is also key, and if you revise from the get-go, it will reduce the pressure later on. Finally, not only is the course fantastic, but the teachers are also extremely understanding and respect everyone's views and opinions in a non-judgmental environment.